Dr. Huebner here, Natural Transplants. I'm here with a follow-up of a patient, a friend of mine actually, and I wanted to show the suture line. A lot of people are concerned about how the suture line is going to look. You may have seen in some magazine articles where people have a popsicle stick wide scar all the way around the back, and a lot of proponents for FUE or follicular unit extraction tout that as a benefit over using the strip method. I'm going to show you now exactly what the strip method should look like in somebody that's healthy, and I can show you multiple examples of this. I'm going to have them come around here, and the first thing you can see is, again, this patient's now coming in for another procedure. First thing you can see is that the scar is completely not visible from the outside, not even close. Gary and the patient here has his hair down pretty short. So I'm going to show you what a suture line looks like. So just putting the comb through the hair. There's certainly no popsicle sticks sticking out here. Right there, I'm going to put this pointer right on the scar. It's about 1 millimeter wide, and it's just a little discolored. It's a little whiter than the actual rest of the scalp. I don't know if you can see that. Does the camera pick that up? That is a suture line. And people ask me all the time, well, why do people have scars like that? What are they doing differently than what you're doing? And there's a lot of things that go into suture lines. That little tiny line right there, that's a suture line. If you didn't know if you wouldn't know what you're looking for, you wouldn't see it. I bet his hairdresser can't even find that line. All the way around that line right there. That's it. Right there. There is no way that line will ever be an issue for him. So we're talking about what goes into a suture line. Technique number one, you have to have someone that's experienced in lacerations. My experience as an ER physician, trauma, we do lacerations every day. So bringing it, the way you bring it together, the way you cut it, depth of the cut, the tension on the cut is a huge component of what makes a good suture line. The other thing we always tell our patients is after surgery, you really have to rest, sleeping in a semi-upright position for several days. You don't want to go to the gym for 10 days, wait till the suture comes out before you go to the gym or do any strenuous activity. Those are all so important in getting a good suture line. Here at Natural Transplants, we guarantee you'll have a suture line just like my friend here. And if it's not right the first time, we'll correct it at no charge. I can't remember the last time we've had to do that. But rest assured that the strip method will give you a great result. You can wear your hair any way you want, and we guarantee that. Thanks so much.